Hi everyone, I'm Dimanthu Disanayaka. So far, we discussed about how the community health nursing practice developed throughout the world, what are the main global health programs launching in the world. So, today we will discuss about community health nurse, the roles and functions performed by community health nurse. So, this is the third topic of the module, um, and these are the learning outcomes. By the end of this topic, you should be able to describe the different types of nursing models used in the community health nursing practice, explain the core concepts underlying community health nursing practice, discuss the importance of public health nursing assessment, and describe the roles and functions of community health nurses. Let's turn towards the introduction. You know that community health nurses serves first for the people. So, it is called as population focused nursing. Not only the health of the individual person, but also focus the health of the population or communities. Establishment of standard of practice is a hallmark of community health nursing profession. Can you say why we need standards? Actually, these standards are to assure the quality of your care. To maintain the standards, WHO Nursing and Midwifery Unit prepared a report called a framework for community health nursing education. So, this framework describes the community health nursing practices and implications, key personnel in the community health care system, and community health nursing education. It describes the core concepts underlying community health nursing practice. So, these are the concepts of community health nursing practice. So, first is the trends in healthcare delivery. Community health nurse needs to identify the trends in healthcare, and they need to provide care according to the changing needs of the community. You know that demographics are changing. So, for example, at present, the elderly population is increasing. So, the community health nurse should be skillful to identify the needs of the elders, and she should be skillful to provide necessary care for the elders. Not only the demographics, but also the disease patterns also changing. Earlier, a lot of people died due to the communicable diseases, but nowadays mortality rate due to non-communicable diseases is high compared to the communicable diseases. So the community health nurse should be adequately knowledgeable about non-communicable diseases and how to care for the patients with non-communicable diseases like diabetes, hypertension, and high cholesterol. The second concept is on care demands leading to the development of the cost-effective, high-quality and innovative systems of the community health care that are accessible to all citizens. So, these demands may be various types. Those may be related to clinical care, healthcare support for healthy activity and welfare, and other support. Clinical care includes delegate medical treatment and observations, symptoms management, wound care, surveillance, and referral or follow-up for acute and chronic illnesses. Some of the healthcare includes case finding, screening and surveillance for diseases, immunization, disease investigation, and management of chronic diseases, and providing health education. Support for healthy activity includes health teaching, health promotion, capacity building for informal caregivers, and promoting health behavior. Welfare and other support includes aids and tools for day-to-day activities for disabled, compensation for caregivers, caregivers care in bedridden patients, living allowances for the needy, etc. So, community health nurse needs to coordinate these services and provides the support for the needy. So, key actors in the community healthcare system includes individuals as they engage with self-care, families, and the community, and the healthcare providers like doctors, nurses, and other healers. Practical implications of community health nursing is the next concept, and these practical implications include carrying out community health services and care activities according to the needs of the community, identifying the health problems and health risk. Uh, so you have to provide culturally appropriate care according to the preference of the people. So those are aimed at promotion of health of the entire population. As I told earlier also, community health nurses must be knowledgeable and aware of the community concepts when providing care. So the next concept is the key to the success of community health nursing. So this key includes the collaboration with other sectors and organizations, best use of information, and updating the community health nursing knowledge and skills. The next concept is the use of systematic process in the community health nursing. So usually when we provide our care, you know that we follow the nursing process in the hospitals. Same as in the hospitals, we can use that process to for in the community health nursing settings also. So this process includes assessing the needs of the community, identifying the problems, planning and implementing a needs care. The last concept, continuous education, is very important to prepare the nurse to identify, assess, plan, implement, and evaluate in the population at risk. Okay, now we'll talk about the standards of public health nursing practice. The Court Council of Public Health Nursing Association developed a standard practice for community health nursing in 1999. This was titled as Scope and Standards of Public Health Nursing Practice. So this is divided into two. First one, standards of care. Second, standards of professional performance. First we'll talk about standards of professional performance. So those include 8 standards you can see in this picture. So they are quality of care, performance appraisal, education, collegiality, ethics, collaboration, research, and resource utilization. So, uh, so to provide a professional care, you need quality care. You have to provide quality care, and performance appraisal is needed to uh, assure the performance of the uh, healthcare provider, that is community health nurse. And continuous education is also a main component of professional practice to update the knowledge. And you have to work as a team, and you have to adhere to your ethics, and you have to do research uh, to use those research findings for the practice, to use the evidence-based practice to increase the quality of care. And you have to use the resources effectively to provide the care. So using those things you can assure the standards of your performance. Now we look at the standards of care. There are 6 standards, and those include assessment, diagnosis, outcome identification, planning, assurance, and evaluation. So now we will move on to the roles and functions of community health nurse. Community health nurse has to play different roles in the community. Those roles include case finders, leaders, change agents, community developers, coalition builders, researchers, and advocate. As a case finder, the community health nurse should develop knowledge of signs and symptoms of health-related conditions and contributing factors. Furthermore, she needs to use diagnostic reasoning to identify potential cases of diseases, other health-related conditions, and provide follow-up care to the identified cases. So, as leaders, what community health nurses can do? So, as leaders, the community health nurses should identify the need for action. If you see a health-related problem in your community, you should take prompt action by giving leadership to others to solve the problem. Not only that, you have to assess the situation and followers to determine appropriate leadership style. And you have to motivate your followers to take necessary actions, coordinate group members in planning and implementing actions as a leader. Furthermore, you have to assist followers to evaluate the effectiveness of the actions taken. As a change agent, you have to recognize the need for change, alert others to the need for change, and motivate others to change and initiate and direct change. Now we see, as community developers, what you can do. As community developers, you can assist community members to identify health issues of concern, participation in data collection relevant to issues of concern, mobilize community members to take actions, assist with coalition development to foster Community action: assist community members to identify achievable goals, participate in the development of strategies to accomplish identified goals, and participate in the implementation of community strategies to achieve goals. Okay, the next role is the coalition builder. Coalition is a get together of people for combined actions working towards the same goal. So, as a coalition builder, you have to identify potential coalition members. That means the people who is willing to work towards a common goal based on common interest and assets available. Present as a coalition builder, you have to present potential coalition members with the benefits to be achieved through alliance, participate in the delineation of coalition goals, assist in the development of operating guidelines for coalition, and participate in the selection and implementation of strategies to accomplish coalition goals. Another role of community health nursing is the researcher. You have to participate in research to update your knowledge, and you have to use that updated knowledge for your practice. That means you have to use evidence-based practice to maintain the quality of your care. Not only that, you have to disseminate research findings to update others' knowledge also. Finally, you have to play advocate's role as a community health nurse. As an advocate, you have to give voices by building trust, assessing and learning of the population. As a community health nurse, you have to work in various settings. Sometimes you have to work in homes, sometimes in ambulatory care settings, schools, and in office settings, recorded as occupational health settings, and residential institutions like elders home, children's home, and the community at large. You have to finally work in the community at large. So community health nursing practice are not limited to a specific area, but are practiced anywhere their service is required. Now we'll discuss about some sorry. So these are the activities of public health nurse or community health nurse proposed by American Public Health Association. So the first one is provide essential and required input to interdisciplinary programs. That means you have to monitor, anticipate, and respond to public health problems in population groups, regardless of the type of disease or public health threat. Second, you have to evaluate health trends and risk factors of population groups and help to determine priorities for targeted interventions. Third, work with communities or specific population groups within the community to develop public health policies and targeted health promotion and disease prevention activities. Fourth, participate in assessing and evaluating healthcare services to ensure that people are informed of programs and services available and are assisted in the utilization of available services. So those are the Proposed activities by American Public Health Association as community health nurses activities. Okay, so far we discussed about the roles and functions of community health nurse. Now we will discuss about some models used in community health nursing. So these models assist the nurse to evaluate the client's health and to plan, implement and evaluate effective nursing care to improve health. To direct practice, nursing models must incorporate three basic components. These components are the client, the goal of nursing intervention, and the activities involved in nursing interventions. So these are the commonly used models for community health nursing. So these are Newman's healthcare system model, community as partner model, Florida Atlantic University community nursing model, Pender's health promotion model, public health promotion model, and public health nursing intervention model. So we will discuss one by one. First, Newman's model. Newman's model sees a person as an open system interacting with the environment. According to this model, health is dynamic. So the client is composed of a basic structure, lines of resistance, normal lines of defense, and flexible lines of defense. The client system is striving to prevent penetration of system by variety of stresses. These stresses may be intrapersonal, interpersonal, or extrapersonal. Stresses are the tensions that produces changes in the normal environment, or problems or conditions that cause instability of the system. For example, it may be a germ try to invade the human body, or unstable emotion like anger, sad, or improper relationship with a person in the society. The client will be healthy if he can prevent penetration of the person's system by the stressors successfully. Normal line of defense maintain the wellness state, and it is the normal reaction of the client in response to the baseline determinants of wellness. For example, practicing healthy behaviors prevent persons from getting ill. So these will be the normal lines of defense. Line of resistance acts when the normal line of defense is invaded by too many stresses causing alterations in health. Flexible line of defense helps the body to adjust to the situation that threaten the imbalance within the client's stability. For example, if a germ invade the body, our immune system try to destroy it. So we can take those reactions as flexible lines of defense. These stressors may be physical, psychological, or sociological. Then the next model, it is the community as partner model. So this model uses the basic concept of Newman's model. In this model, the client is the community or population group along with the beliefs, values, and social systems. The core is surrounded by 8 community subsystems that affect health. So these subsystems includes physical environment, education, safety and transportation, politics and government, health and social services, communication, economics and recreation. If these subsystems are strong, the person will be in a healthier state. So this example shows application of community as a partner model to the problem of HIV in adolescents. You can go through that. And now we will see the next model. It is Florida Atlantic University Community Nursing Model. So this model is designed to focus on community health nursing for school-based practices. The central core of this model includes nursing services provided to enhance, promote and protect health as well as safety. These services include design and coordination of care, health education, health screening, and services to protect well-being such as immunization and primary care, and the services to nurture the wholeness. According to this figure, first circle involves persons and groups in the setting that have common interest in the health of the people. Service activities within the circle include consultation and collaboration services, community assessment and community development activities with activities and evaluation. The second circle is local organizations and groups that are concerned with the health of school children, such as school district department, local health agencies, and others involved in the health care of the school population. These groups develop policy for the settings relevant for the population. Community health nurses also represent this circle, and they are involved with consultation and collaboration in policy development. The third circle represent agencies and organizations at higher societal levels, which is the state as well as regions or nations that influences the health in the target setting. You can see there is an interaction between all these levels. That is about you can see there is a interaction between all these levels. So that is about Florida Atlantic University Community Nursing Model. Now we'll discuss about Pender's Health Promotion Model. It's a famous model and a very important model. So this model notes that each person has unique personal characteristics and experiences that affect subsequent actions. The set of variables for behavioral specific knowledge and affect have important motivational significance. Those variables can be modified through your nursing actions. Health promotion behavior is the desired behavioral outcome, and that is the end point of this model. So, according to this model, prior behavior and inherited and acquired characteristics influence beliefs, affect, and enactment of health promotion behavior. Perceived barrier can be an obstacle to action, and perceived self-efficacy or competence increase the likelihood of behavior. Greater perceived self-efficacy results in fewer perceived barriers to specific health behavior. Positive affect toward behavior results in greater self-efficacy. Persons are more likely to commit to and engage in health promoting behaviors when significant others made the behavior, because they like to imitate, expect the behavior to occur, and provide the assistance and support to enable the behavior. Families, peers, and healthcare providers are important sources of interpersonal influence that can increase or decrease commitment to and engage in the behavior. So, and situational influences can increase or decrease the commitment towards the behavior. Let's take a smoker as an example. So, if he knows the benefits of quit or smoking, and if he feels that he can quit that behavior, he will try to quit smoking. But if he feels that he is not physically well when stopping smoking, he will not try to avoid it. So it will be a barrier. But if the if there is a pressure from family members or significant others, he will try to quit smoking, and situational barriers like peer pressure to smoke will hinder the commitment to the behavior. Sometimes positive situational influences will promote the healthy behavior. So according to health promotion model, various factors will affect for the health promotion of a person. So as a community health nurse, you can change these behaviors through your nursing interventions. Now we will look at the next model. It is called public health nursing intervention model. So this model consists of 17 identified community nursing interventions. You can see at the outer circle. These nursing interventions cross over 3 levels of population-based practice. Those 3 levels are individual focused practice, community focused practice, and system focused practice. So the final model. Finally, we will talk about the public health nursing model. Actually, this is a conceptual model rather than a guide for practice. So according to this model, community health nurse is like a flowering tree. So according to that model, core public health nursing functions include promotion and protection of people's health, prevention of diseases, and giving access to health for all the people. Community health nurse perform these functions with the collaboration with other sectors in the country. So that is about the models that we used commonly in community health nursing practice. So if you have any questions regarding the roles and functions of the community health nursing, so the models that we use in the community health nursing practice, you can contact us and ask. So thank you very much.